So the precautionary principle argues that we should take action even when we don't have certain final evidence, because you don't want to wait for long-term epidemiological evidence, the way we had the situation with lung cancer, where it took forever, not because the science wasn't up to it, but because the political opposition and the medical misunderstanding was so great. So within the medical establishment, there was a lot of resistance to lung cancer and its relationship to tobacco. And there was a lot of policy implications of that, because if you started to regulate tobacco, that was a major part of the economy. Likewise with chemicals, they're such a big part of the economy that nobody is wanting to threaten economic interests. But we find all of a sudden that, studies will show us that a chemical shows up where it shouldn't be. We hadn't thought about it before. Example that I like a lot is in Sweden, back around 1999, they discovered a lot of flame retardants, a particular type called PBDEs, polybrominated diphenyl ethers, in breast milk. In Sweden, like a lot of other countries in Scandinavia, they are always monitoring health and in the environment. They have excellent medical registries. They can track down, DNA over generations. They can look at the heritability of disease, and they keep focus a lot of attention on finding out what's going on around us. And their approach was, this doesn't belong here, and the best thing to do is to get rid of it. So they outlawed PBDEs. They didn't say, well, let's have a long period of funding from our federal agencies to study this. They didn't say, let's have environmental impact assessments, or let's ask the companies, would this hurt their bottom line if we regulated it or banned it? They just said it doesn't belong there. And this breast milk is really important, because this is what women are giving their babies to give them all the immunities to avoid disease. So why should we put this strange chemical into their bodies? So that's what the precautionary principle would say. It's a foreign substance. It doesn't belong there. And we have evidence also that it does things, at least in animal studies, that we didn't have a lot of human data at that point. And the precautionary principle basically says that we've got to take action before the certainty, sometimes because we know that other things in that chemical class have effects, and sometimes because we know it has effects in animals, sometimes because we just know it's very persistent, that it's a kind of chemical that it likes to go into fats. It's lipophilic. And that would necessarily mean that it could, of course, store in places where it hurt people. It will bioaccumulate and stay in their bodies for a long time. It will stay in the dust or in the fish that people eat for a long time. And we don't want those persistent organic pollutants to be in the atmosphere. We're not going to wait for a long experiment that takes decades and decades, an uncontrolled experiment of releasing all these chemicals that don't make sense. And many of these chemicals were designed to do very odd, different kinds of things. And so it doesn't make sense that we're letting this huge array of chemicals in. We have no program for testing them. And with chemicals, we don't have to prove they're safe before we use them. So it's the opposite of what the Food and Drug Administration does, is to say, if you want to put this additive into peanut butter, if you want to put this drug into people's bodies to prevent a disease or cure a disease, you have to show that it's safe and effective. It's the exact opposite with chemicals. The onus is on us to then say, these might be dangerous or they are dangerous. And we don't usually have the wherewithal to do those kinds of studies. They're very expensive, and they often take a long time to do. So the precautionary principle is fairly new. When I began working on this project, contested illnesses project, about 11 years ago, I probably started to write the grant maybe 12 years ago. It's very, very uncommon to hear the term. And there was only a very small handful of people who were thinking about this. A number of people like Joel Tickner and Ken Geiser at the University of Massachusetts at Lowell. And they spent a lot of time with European regulators and scientists figuring out that this was an important new direction. And they began to bring it to this country and to hold conferences and to bring Europeans over here and to say, we are a protective society. We put more of our gross national product into health and well-being than many other countries. We take seriously protecting public health. So listen to us about this precautionary principle business. And it spread very rapidly. People in this country began to see, maybe this is why there are so many crazy clusters of cancer and other diseases, why there are so many endangered species dying off because of chemical hazards and other kinds of things people are beginning to see here and around the world, that there's something going on in the environment with this post-World War II petrochemical explosion of toxics that are being released. And it just gelled, in people's minds as a great new way to think of things. And it avoided the idea that we have to wait for long-term studies to prove that there's danger. And it just grew and became very popularly accepted in a fairly short amount of time.